we go. Awesome. So thank you all so much for showing up today. I know this was kind of a last minute thrown together webinar, but a great turnout nonetheless. I know that folks are really excited about the implementation of Medicaid expansion coming in on December 1st here in North Carolina. But I'm sure that folks also have a lot of questions as we kind of look into the way that implementation is going to roll out. So for folks who do not know me, my name is Matt Martin. I use he and they pronouns, and I serve as the Associate Director with the North Carolina AIDS Action Network. We are the HIV advocacy and policy organization here in North Carolina, and really appreciate such a big group coming together to have a Q&A session about HMAP and open enrollment and Medicaid expansion and all things that are going to impact the HIV community with this rollout. So just a couple of quick things. This meeting is being recorded, so if you don't want to be recorded or don't want your voice recorded, feel free to stay muted and turn your camera off, and drop questions in the chat throughout. We're going to give John, who's with the DHHS, a few minutes just to kind of give some updates, and then we'll mostly have a Q&A session where you're welcome to come off mute and ask your questions or drop them in the chat, whatever you are most comfortable with. Do ask that if you are not speaking, you are welcome to keep your camera on if you would like to, but do ask that everybody go on mute when you are not speaking, just to limit any background noise. And I think that is about it. So with that, John, if you are good, I'm going to go ahead and turn it over to you for some updates.
Yes, I'm good. Thank you, Matt. Thanks for having me. My camera was working fine, but it looks like I disappeared from view. I don't know. So I apologize that I'm not on camera. I'm not exactly sure what happened. Of course, it was working until Matt introduced me. So hi, everybody. Thanks for being here today. And I am super excited to be talking about the HMAP program and the all the ways in which Medicaid expansion is going to impact our program and our clients. So I'm going to start with a brief program update, non-Medicaid things, and see if anybody has any questions there. And then we'll jump into some discussion about Medicaid expansion and what that means for our clients. And I suspect there'll be lots of questions, but I can also just talk about this stuff forever because it's been the thing that I've been living in for the last couple of, I guess, months in preparation for this. So let me start with a quick update on the summer recertification, which has ended, and it ended at the end of September. The recertification numbers were a little lower than we normally see, and I'm not sure if that is just a thing that happened this year or if there's something going on. Not tremendously lower than usual, but a little lower than usual, although we've seen quite a bit of volume in October and even right now in November of people who missed the deadline and are working their way back onto the program. Hopefully this isn't an ongoing problem, although I hope that next year in the summer, we will be rolling out our electronic eligibility system called READS, which will replace the very old antiquated POMCS system that we currently use in-house that requires us to have paper applications sent to us by mail or email or fax. So we'll be rolling out a new system next year, hopefully for the next summer recertification. So maybe this will be the last time we do this old style of recertifying clients for HMAP. I'm also hopeful, and I don't have a final decision yet, but I'm hopeful that we'll be making an announcement about winter recertification, which would normally be starting soon in January, but I think we will hopefully be doing something a little different with the winter recertification as well, as we prepare for not only Medicaid expansion, but also rolling out the new READ system. So stay tuned for more on that in the future. The other thing I want to talk about that isn't specific to Medicaid expansion, but is somewhat complicated by the timing of Medicaid expansion is our PCAP program, and I think everybody here knows, but PCAP is the program that pays for premiums and co-pays for clients who enroll in insurance on the marketplace. Open enrollment started November 1. We've already seen some clients who have had their appointments with the navigators and have signed up for insurance for 2024, so I'm excited about that. We don't quite have a sense of what the volume looks like just yet because the folks over at the Navigators Consortium are so busy enrolling clients that they haven't been able to take a breath and provide a whole lot of information. But from what we understand, a lot of appointments were made and clients appear to be keeping their appointments and going through the process of enrolling for insurance for 2024. So I hope that by the end of November, early December, I'll be able to send an update on kind of where we are with PCAP and open enrollment. A couple of reminders about PCAP and open enrollment. There are 4 carriers that we can work with for clients who want to receive premium and copay assistance through PCAP. That would be Ambetter, AmeriHealth, Caritas, Blue Cross Blue Shield, and Cigna. There are a couple other carriers who are offering plans on the marketplace, but unfortunately, those carriers have opted not to work directly with us and accept our premium payments. There's a few that we're hoping that we can get to start working with us next year. So I'm hoping next year we'll be able to add some more to that list. But right now we have those 4, and between those 4, we have pretty adequate coverage. We have coverage in every county in North Carolina, and we've got pretty adequate coverage around the state. Another reminder about PCAP, we're currently not working with bronze plans, so we are requiring clients to pick a higher metal level than bronze plans, which is fine. That usually comes with a higher cost, which is okay because we're picking up the cost, we're paying the premiums. We have found that the coverage is better on the higher metal level plans, and in the long run, even though there's a higher premium cost, there's a little bit less on the out-of-pocket cost, which is good for the program because we also pay copays, but it's also better for the clients because they pay their Medicare, their medical copays. As I mentioned before, we only allow clients for PCAP to enroll through the Navigators Consortium, so everybody has to use the Navigators to enroll. There's a referral form for making appointments. I think that seems to have worked pretty well this year. I know there were some hiccups last year, but we haven't heard any feedback that things weren't working or that making appointments were. We've heard good positive feedback about making appointments. So hopefully clients will keep those appointments. It's a good time to remind your clients. If you have clients who you've helped set up an appointment with the navigators, remind them that they need to be ready for that phone call from the navigators, be prepared, have all the documents necessary. And those calls can take a little bit of time, so they need to be prepared to stay engaged and work through the entire enrollment process with the navigator at that time. I think those are most of my updates related to PCAP. Last year we had some challenges because of some insurance broker interference. There were some insurance brokers that some of them were just blindly reaching out to clients or finding people at maybe events that individuals were going to, or some were reaching out to case management agencies and saying, hey, let me work with your client to get enrolled in insurance. And that ended up causing a lot of complications. We were able to get it resolved and get clients switched to the correct plan, but we don't want clients working with brokers. They have to work through the navigators, the NC Navigator Consortium, to enroll in a plan that we can then cover through PCAP. So I think that's everything related to PCAP. Does anybody have any questions about any of that so far? So then I'll get into all the fun stuff related to Medicaid. I see in the chat, I'm just looking in the chat. Is there still an echo? Can you guys hear me okay?
Yeah, no echo on my end.
Okay. And I see a question about emails. There seems to be some confusion about the HMAP email listserv. If anybody is not getting regular emails or updates from me, or if you weren't getting emails from Dietrich Purcell prior to last month, please let me know. Send me an email, and we'll get folks back on the HMAP listserv if you're not getting emails. I sent a long memo yesterday about HMAP and Medicaid. So if you didn't receive that email, that probably means you're not on the HMAP listserv. So if you're not getting those emails, you can contact me by email, and I'll get you added to the listserv. And yeah, I see a bunch of discussion in the chat about emails. Yeah, just send me an email, please. I can put my email address in the chat. Okay. And I saw a question about recertification and which recertification I was referring to. So I'm hoping that we will be able to make an announcement soon about the winter recertification, which would be coming up, which would only be for our UMAP uninsured clients. But stand by for more on that. And then we are also anticipating that for this next summer's summer recertification period, we should be rolling out our brand new electronic eligibility system. Okay. Not hearing any other questions, I'm going to jump into some discussion about Medicaid. Do we want to start maybe with some, well, I don't know or does anybody have any Medicaid questions that they know they want me to talk about, or you just want me to tell you everything I know?
Let's start with kind of an overview of what y'all are going to be seeing with Medicaid and HMAP clients in particular, and then kind of
Sure.
there with questions if that's cool.
Yeah, that's fine. So in the memo that I had sent out yesterday, I included in that email a list of links from the North Carolina Medicaid program. It should be very helpful. A lot of the documents and the links in that email provided information about Medicaid expansion, including like client-facing one-pagers, as well as like a slide deck with information, and there was a frequently asked questions document. So there's a lot of information in the email, in the body of the email as well, a lot of links that Medicaid has shared as part of their toolkit for sharing widely with the community so that everybody is kind of aware of how this is rolling out from Medicaid. And then in the email itself was a memo that I also put together. So we know that Medicaid is a more comprehensive, it provides more comprehensive coverage than just HMAP or Ryan White. So we anticipate that this is going to be a really good thing for our clients in the long run. But we also realize that this is going to be a huge change for them as well. And it's going to be a little bit of work, I think, for case managers and providers to get the clients to, some I think will agree right away to move to Medicaid, but we're already hearing some clients don't really want to. They know how Ryan White works, they know how HMAP works, and they are reluctant or resistant to change, which I totally understand. But in the long run, Medicaid will be a much better health coverage for these clients. So our goal is to get them to Medicaid in a safe way. We don't want to rush anybody. We're not going to be throwing anybody off the program immediately. I know there was some initial concern that on December 1st, will that mean that everybody who appears eligible for Medicaid won't be eligible for HMAP or Ryan White anymore? And that is not the case. Clients who are currently enrolled in the program have an eligibility end date, and we are not anticipating ending anybody before their eligibility end date unless they tell us that they have enrolled in Medicaid. And it's important that clients, as they enroll in Medicaid or find out that they have been enrolled in Medicaid, and we'll talk about both of those things in a couple minutes, but it's important as soon as they find out they have Medicaid that they let us know, because we need to make sure we turn off their HMAP, we end date their HMAP enrollment, especially if they're on insurance, if they're receiving services through PCAP or ICAP. We want to make sure that we end date their HMAP enrollments, and we also want to make sure that they, either through the navigators or on their own, reach out to their insurance carriers and end those insurance plans, because we don't want people to be duly enrolled in our program or duly enrolled in insurance and Medicaid. So those are kind of some of the things that have been spinning around in my mind these last couple of months as we geared up for the December 1st go live for Medicaid expansion. And I can't believe it's here, because it feels like it's something we've been talking about for a very long time. But it's here and it's super exciting, but it also is going to be a lot of work for everyone. There are a lot of ways to apply for Medicaid. I won't get into it. I won't pretend to be an expert on Medicaid or how to enroll in Medicaid, but it sounds to me like the best way to enroll in Medicaid is through their electronic portal, which is called ePass. And ePass gives them the ability to set up an account, sign up for Medicaid, complete an application. They have control over, clients will have control over like their communication preferences, and they can log back in and check their status, and they'll get emails or mail from Medicaid based on the information that they provide into ePass. So there are other ways to apply for Medicaid. If a client is not comfortable using ePass, you can work through the local DSS or Department of Social Services office. Applications can be done by paper. They can be submitted by mail, by fax, over the phone. There's a lot of other ways to get onto Medicaid. The NC Navigators Consortium can also assist with Medicaid enrollment, or at least Medicaid applications. But even if the navigators assist, that application still has to go through the regular process and be evaluated, and eligibility has to be determined. So there are a lot of ways to get onto Medicaid. After clients apply for Medicaid, it takes up to 45 days for an application to be processed, similar to HMAP applications. And just like HMAP applications, the more complete the application, the more likely it is to get processed quickly. For applications that are incomplete or have weird, odd situations described in them, I think that will take more time for those types of situations to get resolved or for eligibility to be determined by Medicaid. But once Medicaid makes a decision, if a client or if an applicant is approved for Medicaid, they will get an ID card in the mail and a welcome packet. Most clients will be assigned to, sorry, I've lost my words here. They'll be assigned to one of the Medicaid managed care plans. I was looking for the right combination of words there. And when they apply, they can pick a plan. If they don't pick a plan, then they'll be assigned a plan. And their welcome packet will provide all the information. They'll get an ID card and will provide information about their managed care plan. If they want to change their plan, they can do so in the first 90 days. Their ID card and welcome packet will also have information about their primary care provider. They should be able to pick that when they apply, and if they don't, they'll get assigned a primary care provider, but they can also change that whenever they want as well. once a client gets notice from Medicaid, gets that ID card, gets their welcome packet, once they know and they have confirmation that they have Medicaid, again, it's so important that they contact the HMAP program, or they ask their case manager to contact the HMAP program, because we need to end date their HMAP eligibility, because what we don't want is for them to go to the pharmacy to fill meds and the pharmacy to see multiple coverage types, because then that will slow down medication dispensing. They may just charge Medicaid, they may charge HMAP, they may charge, I don't think there's a situation where they would charge both of us, but there could be a situation where the dispensing gets slowed down because the pharmacy is trying to figure out who the correct payer source is. So we don't want to run into any issues there with medication dispensing. So it's best if we find out that they have Medicaid as soon as possible so that we can end date their Medicaid. All right, so that's kind of the things I know about how to get on Medicaid and what will happen when a client is approved for Medicaid. Maybe I'll stop there and see if there are any questions. And again, I don't want to pretend like I'm a Medicaid expert just yet, but I might be able to answer some questions if there are any.
Hi, John. This is Emily with Atrium Health. Can you hear me?
I can.
Okay, great. I hopped on a little bit late, so I hope I didn't miss you reviewing this piece, but I had some questions related to some of the wording on the memo that you sent out. Under this section, let's see, where it says after applying for Medicaid, that first bullet point says applications may take up to 45 days to be processed. I have a feeling it's going to be a lot more than that, because I'm not sure if all the DSS offices are prepared for the influx of applicants. So we've been told it might take up to 45 days for the application to be approved. But later in the memo, let's see where it was, under preparing for HMAP clients to enroll in Medicaid, it says, starting in 2024, all HMAP applicants who appear to be eligible for expanded Medicaid will be required to apply before an eligibility determination for HMAP can be completed. So with the long wait for Medicaid to potentially be approved before an HMAP determination can come through, I'm just concerned that that will leave folks stranded.
That's a really good concern. I share your concern. So let me talk first about the 45 days. I think you're right. I think typically what I'm hearing is that a Medicaid application usually takes less than 45 days in normal times, but I think during the next couple of months, it's going to be a lot of new people, new applications. I think you're right in being concerned about how long that will take. We won't have a lot of control over what that looks like. What I will say is that using ePass is probably the best method for applying for Medicaid. Being mindful about having all the documentation or all the things that are required in ePass done correctly and accurately will also help move that along. And again, we're not going to end anybody's HMAP until we hear that they have Medicaid. So one of the things in my mind has always been like, just because they've applied for Medicaid doesn't mean we're going to take any action on the HMAP side. We want to wait to take action until we have confirmation that, yes, they have Medicaid now. So that should help there. And then I think your second concern is a really valid concern. What does this mean for next year as we get closer to next summer and next summer's recertification period? Our goal will be, and I'll talk more about this at the end, kind of like our plans, our next steps for like the next couple of months. But our goal will be to start as early as, I put in the memo after January 15th. That might be a little ambitious, but hopefully starting in February, early February, maybe end of January, we're going to start to reach out to case managers, start providing lists of who we think might be eligible for Medicaid. I'd love to see people applying for Medicaid as early in calendar year 2023 so that they've given themselves enough time to hear back from Medicaid whether or not they're approved for Medicaid before we get to July 1, so that there's no interruption in coverage. But if we get to a point where we're waiting for, you're waiting for Medicaid and you don't know what to do, we will still continue to allow clients to come onto the program because we don't want there to be any interruption in care. Does that answer all of your questions?
Yeah, so it sounds like for 2024, it's kind of like the adjustment period, but it's going to be more heavily enforced in 2025.
For sure. Yeah, I think 24, this, at least for the next 3 to 6 months, we're really going to be kind of learning as we go here and adjusting, and hopefully everybody moves safely and carefully and lands to Medicaid in a way that works best for them. And then as we get to like the second half of 24 and as we get closer to 2025, we will have to start to probably change some of our policies and start enforcing those policies a little more stricter. But I think we've got some time.
I have a question. I'm asking from a community standpoint. If I have Obamacare, is that basically the same thing as the Medicaid expansion, or do I have to apply for Medicaid expansion?
So if that's a good question, Rita, thank you. So when you say Obamacare, I assume you're talking about the insurance offered through the federal marketplace. And the coverage is pretty comparable. The main difference is Medicaid comes at almost no cost. It comes at some cost sharing, but no monthly premiums are involved. So it would be better for a lot of the HMAP clients to move to Medicaid so that they'll have a more broader coverage at a lower cost to the clients. And that would mean that an individual who has insurance through the marketplace would have to apply for Medicaid. And then after they hear from Medicaid, if they're approved for Medicaid, then they do have to take some action to disenroll from HMAP and disenroll from that insurance.
Okay, will men who use HMAC and maybe some Ryan White programs, will they automatically be added to Medicaid, or will they have to apply?
Everybody will have to apply. That is a great question. Thank you. So this was something that we've been hearing this question a lot too. There is going to be one group that gets automatically enrolled in Medicaid, but it's not going to be the HMAC group. And I'll talk about that group soon. But nobody will be auto-enrolled into Medicaid. So everybody who is on HMAP or one of the HMAP subprograms who appears to be eligible for Medicaid will need to take action to enroll in Medicaid or apply for Medicaid.
So a lot of my clients that have family planning waiver Medicaid, they are receiving letters that they will be switched over from planning waiver to Medicaid, so they don't have to reapply. But
yes,
if they
okay. Sorry, keep going. I didn't mean to interrupt you.
So I'm just saying, so like my clients that haven't, they're the ones I'm talking to about applying. But yeah.
That's right, Vivian, and that's the group. So so it's kind of weird. I've said nobody's going to be auto-enrolled into Medicaid, but Medicaid is making exception for some other, for this very specific Medicaid subpopulation. So anybody who is currently enrolled in the Medicaid Family Planning Program, which is a Medicaid program, but it's a Medicaid program that does not have a very robust set of coverage. It doesn't cover a lot of things and it doesn't cover medications. So we have always allowed individuals who are on Medicaid Family Planning to receive HMAP and Ryan White Part B services because the Medicaid Family Planning Program does not offer comprehensive coverage. That said, Medicaid has decided that they are going to automatically take anybody who is currently on the family planning program, because it is a Medicaid program, and most of those clients' information is already in the Medicaid system in ePass. If they have a recent enough application, I don't know the exact parameters, but if they have a recent enough application and they have all the information necessary to determine eligibility, anybody on the family planning program who appears to be eligible for Medicaid, expanded Medicaid, will be automatically switched over to full Medicaid. And that happened, it's effective December 1, but they did the internal switching. They started the internal switching in their system on November 5th, which was last Sunday. So anybody who had Medicaid family planning and is eligible for expanded Medicaid should receive a letter from Medicaid saying you now have full Medicaid. They're going to get a welcome packet. They're going to be assigned to a managed care plan, and I think they'll be assigned a primary provider, primary care provider if they don't have one already picked in FAST. For us, it's a little tricky. We're working very closely with my colleagues over at DHB, which is the division that manages Medicaid, to try to get data from them about which of the HMAP clients fall into this bucket, because we don't have any good accounting system of which HMAP clients currently have family planning. HMAP staff are going to be in probably for the rest of this month doing a lot of looking up in different systems to identify everybody who got switched over to Medicaid, full Medicaid, so that we can start reaching out to case managers saying, it looks like your client got Medicaid. They moved from family planning to Medicaid. Once we have confirmation that they have Medicaid, some point in December, we will turn off their HMAP, because we don't want them to show up at the pharmacy and create confusion at the pharmacy and not knowing which payer source to use, which will just slow down dispensing. And then if those clients are on PCAP or ICAP, we need them to work with the carrier or through the navigators to disenroll from that insurance plan as well. So we're going to be working a lot in this next probably month or two around all the family planning people. I don't have a good estimate. My best estimate a couple of weeks ago was about 20% of HMAP, but it's looking more like we did a small sample, and of that small sample, it was closer to maybe 25% of our HMAP clients have family planning, which is a significant number of people. So right now we're scrambling to figure out which of our clients made that move and take the appropriate actions so that we can make sure that they know that they're on Medicaid and that they have their, we have the right things turned off on our side. Did that answer your question, Vivian?
Sorry, yes. And one of the things that we're going to be doing internally is we know which clients of ours have on family planning waiver. So we're going to be trying to verify that as well, so we can then turn around and let you guys know.
Excellent. Yeah, I think that this is really going to be a joint effort here. We're going to need to hear from case managers and providers around the state. As soon as you know something, please let us know, and we will do the same. And I think there'll be a lot of communication back and forth about, okay, we found another person who had family planning who is now successfully enrolled in Medicaid.
Looks like there was a question in the chat. Are there any programs in place for the client's medication copays? I know copays can generally be at max $4, but for individuals with nothing, even that can be impossible for them.
Yeah, that's a really good question. First of all, I have super good news, and I don't know how. I actually sent an announcement, I think late last week, and I know Medicaid released a press release, but as soon as we knew for sure that Medicaid was going to be expanding, we started talking about that $4 copay with our partners at Medicaid and saying, this could become a barrier to care. We were successful, and Medicaid was successful in advocating for themselves to eliminate the copay for all HIV antiretroviral medications. So all the ARVs that our clients are taking, when they move from HMAP to Medicaid, they will not have any copays for those medications. And this includes people living with HIV who are already on Medicaid, anybody who's filling a prescription for a HIV specific antiretroviral medication will have zero copays. That's really good news. But I recognize that there are a lot of other medications that our clients are on, and unfortunately, there will still be the $4 copay. I think they're all $4, but there might be some that are a little less, although I think most of them are $4. There are some copay assistance programs that can help, although I don't know which ones are available for Medicaid clients. From what we have heard and what Medicaid has told us, well, this part I know is true. There's federal regulations that say the pharmacy can't withhold medication if a client goes to the pharmacy or is filling a prescription and can't pay the $4 copay. So they can say, I don't have $4, I can't pay it. The pharmacy by law has to give them the medication. Unfortunately, the law doesn't prevent the pharmacy from sending that client a bill, or when they come back to fill meds again, say, hey, you still owe us $4 for your last prescription. They can't withhold the medication, but they don't have to waive the $4 permanently. Our staff in the HMAP program will start to reach out to some of our connections at the different manufacturers, the drug companies, and see which one of them have medication copay cards or links to medication copay assistance programs. We don't have anything in HMAP. We don't have a mechanism for paying copays, but we will do our best to put together a list of resources for medication copays. And if anybody has resources that they want to share with me, I would love for them to send me an email. That would be great. Matt, did you see any other questions in the chat?
Not that I am seeing, but folks, feel free to drop them in if you have any, or feel free to come off mute.
So I think the other thing that I want to just spend a couple of minutes talking about is the impact on, specifically on PCAP and ICAP. So PCAP is the program we pay copays and premiums, and ICAP is the program we pay medication copays. Both are for marketplace insurance plans or Obamacare plans. And the clients who are on PCAP or ICAP now, or hope to be on PCAP and ICAP or ICAP in 2024, who are enrolling in insurance right now during open enrollment, are in a weird situation because open enrollment started November 1. It runs through middle January 15th. And part of that open enrollment process is screening for Medicaid. So the first set of questions that the navigators will talk to an enrollee or client about is, trying to make sure that they aren't eligible for Medicaid before they start deciding about which plan is the right plan for them to enroll in. On December 1st, Medicaid will have officially expanded, and the criteria for that screening will have changed. So everybody who screens in the month of November, and we're encouraging all of our ICAP and PCAP clients to get enrolled in insurance as quickly as possible, because we need them enrolled in November so that we can get their information and make their first payment so that we can ensure their insurance starts January 1. So the sooner they enroll in insurance, the better. Unfortunately, on December, Medicaid will have expanded, and some of those clients will have joined insurance for 2024, but now will be eligible for Medicaid. So it causes this little bit of this big conundrum. What happens now? Let's say John is not eligible for Medicaid in November. John signs up for a Blue Cross Blue Shield plan for 2024. And then on December 1, John becomes eligible for Medicaid. Well, John's got a couple options. John can apply for Medicaid right away. And as soon as John knows that he has Medicaid, he gets his welcome pack and his ID card, he can let the HMAP program know, I have Medicaid now, I need to disenroll from Medicaid, and I will call Blue Cross Blue Shield and disenroll from that insurance plan. And that is perfectly fine. Just gonna mute for 1 second, I'm sorry. I don't want to cough in everybody's ear. John can also decide that he likes his Blue Cross Blue Shield plan, and he likes that PCAP and HMAP are paying his premiums, and that works for him, and he wants to just keep that insurance for the rest of 2024. That is fine as well, because when John signed up for that insurance in November, he was not eligible for Medicaid, and he was already enrolled in the PCAP program. We're not going to throw John off the program halfway through 2024. What we will do is work with John as case manager as we get closer to the end of the calendar year to make sure that John applies for Medicaid and doesn't enroll in insurance for 2025, or at least applies for Medicaid early enough so that he knows before the open enrollment period starts at the end of 2024. But it does create a little bit of a more complicated situation. What we don't want is for John to get insurance, then get on Medicaid, not let anybody know, start using Medicaid, keep the insurance going, because what we don't want is a situation where by having multiple coverage sources, the pharmacy doesn't know how to serve John, so John doesn't get his meds. Or we don't want a situation where John is eligible for premium subsidies and getting subsidies towards his premiums, and also enrolled in Medicaid, which would make him ineligible for those subsidies. We don't want John to get a bill from the IRS one day that says, hey, you took subsidies when you already have Medicaid. So it's really dangerous to have a client who is duly enrolled in Medicaid and marketplace insurance, especially if they're drawing subsidies, if they're in that small group, which is really the people above 100% FPL. And only from 100 to 138 would be eligible for Medicaid expansion. So there's not a huge group here, but there's a lot of ways for this to get really complicated really quickly. So you'll be hearing a lot from me. You'll be hearing a lot from the HMAP staff. We'll be sending memos and emails and calling case managers and sharing lists with them. I think you'll also, case managers may not, but clients will be hearing a lot more from Medicaid than they may be used to hearing. And at some point, CMS will probably start doing some checking on the back end to make sure that nobody's duly enrolled. And we'll be reaching out to either clients or us or Medicaid about clients who appear to be duly enrolled. But we're going to do our best to prevent dual enrollment. But again, I think this is going to get a little messy, especially with open enrollment happening in November and then Medicaid expansion occurring in the middle of the open enrollment period. Does anybody have any questions about that? I know that's a lot.
We did have somebody ask, how do we ensure that we're on the list to receive emails for updates?
So if you have not received an email, you didn't receive an email from me yesterday with a memo about Medicaid. That means you're not on the HMAP listserv. You can email me directly and I will make sure you make it onto the HMAP listserv.
And John, I'm going to redrop your email in the chat for anybody who might have joined late.
Thank you.
All right, any other questions that folks may have?
Hi, I am actually a navigator with the Navigator Consortium, and I work on with some PCAP clients. Just to clarify, if a client is in that 100 to 138%, wants to switch to Medicaid, but they can't risk a coverage gap of applying for Medicaid on December 1st, then not being approved for 45 days, is the correct path to go ahead and enroll in PCAP, and upon hearing a Medicaid approval and them being enrolled in Medicaid, then go back and, cancel the marketplace coverage and disenroll from HMAP.
I think that is a good path. I think
Okay.
that is certainly acceptable and allowable and makes sense, because we would rather have a little bit of an overlapping coverage than a gap in coverage. The only other alternative, and this may be outside of maybe the navigators like knowledge area, but for case managers, the only other alternative would to be if you have a PCAP client now who is likely going to be applying for Medicaid right away, or they're not family planning, we could not enroll them in insurance for 24 and just have them stay on the UMAP program, which is the uninsured program. So UMAP would be another good safe place within HMAP to have coverage, at least medication coverage, until you hear from Medicaid. But enrolling in PCAP and then disenrolling from your insurance once you have Medicaid coverage or confirmation from Medicaid is perfectly fine.
Okay, thank you.
You're welcome. Good question.
Is there a check and balance system to ensure that individuals, and just by the example that she used, using market rate and then applying for Medicaid, that one doesn't keep going on when you have another one? That makes sense.
Yeah, that's a good question, Rita. CMS will do some checking on the back end, but I think they won't start to do that until a couple months after Medicaid has expanded. So there aren't any quick checks for dual enrollment. I think a lot of them will get caught at the pharmacy. The pharmacy typically will reach out to us and say, hey, it looks like this client has multiple coverage sources. Which one should we charge, or which one are you aware of this? And then we can get it resolved. My fear is if we rely too heavily on the pharmacies finding it, that we could slow down dispensing if all of a sudden 1,000 people have dual coverage and the pharmacy is waiting on a response from HMAP. So I'm hoping that we've been working very closely with Medicaid to do some data sharing. I don't know how quickly that will happen, but we've got it on the fast track. And then I'm hoping, again, a lot of good communication between case managers and clients and program staff will identify when people have multiple coverage sources so that we can get that resolved.
This is kind of putting the horse before the wagon, but what would cause a client to lose their Medicaid coverage? And if so, can they reapply?
Yes, I can answer the second question. If somebody loses their Medicaid, then they can always reapply for HMAP. They can also reapply for Medicaid as well. I don't know all of the eligibility criteria for Medicaid, but I would imagine a change in income would be the thing that would trigger becoming ineligible for Medicaid. But if somebody becomes ineligible for Medicaid, they can reapply for HMAP.
John, you mentioned at the Ryan-White providers meeting the other week that there's a difference between the way income is calculated for Medicaid eligibility and how we calculate income, or how income is calculated for HMAP. Do we have any more information on what that calculation looks like? So that we're able to screen here internally. I'm especially thinking of like patients that are newly diagnosed, new to care, helping us figure out quickly which way to refer them or help them enroll.
That is a good question, Emily. I don't have a good handle yet on the difference, but I will look into it and see if we can share something with the community listserv as soon as we have a little more clarification. See, we're getting close to time, and I want to leave it open for more questions if there are any, but just want to kind of give everybody a general sense of what our plan is, and this changes pretty regularly. But right now, in my mind, the HMAP staff, our plan for the next, I don't know, 6 or 10 months or so is right now, from now till the middle of January, is really our goal is to get through open enrollment, get all the PCAP and ICAP clients enrolled in insurance for next year, and identify everybody who was on the family planning program who became auto-enrolled into Medicaid, get those clients sorted out and end their coverage. Also address any issues that occurred as a result of like insurance enrollments occurring at the same time as Medicaid expansion, and really working closely with the PCAP staff on the PCAP clients to make sure that we don't have anybody who is dually enrolled in Medicaid and insurance. Once we get through the middle of January-ish, then I think for the rest of January and February, our goal will be around catching up, creating new lists, communicating with the case managers and providers, and kind of getting organized to identify who else looks to be like they should be applying for Medicaid, so that we can spend hopefully the earlier parts of March to June working with case managers to get people signed up for EPASS and applying for Medicaid, so that we know well in advance who has Medicaid before we get to the summer recertification. And then somewhere in there, we'll be figuring out how to roll out our new electronic eligibility system around the same time. Are there any other questions? Didn't see anything else in the chat, but I'm gonna look again. Matt, did you see anything?
Nope, nothing else in the chat. I guess we will give one final call. Oh, is HMAP being approved through 9/30?
So more on winter recertification very soon. I hope to be able to share some updates on what the winter recertification period will look like and when everybody's approved for it. Currently, UMAP clients are required to recertify from January through March, but I'm hoping that we can not do that this year because of Medicaid expansion and because we have this new eligibility system rolling out, but I don't have a final answer just yet. Everybody else on the program, so ICAP, PCAP, and SPAP, is already currently approved through 9/30. 24.
All right. Well, hearing no other and seeing no other questions, I will give folks an extra 3 minutes back in their day. John, we're super appreciative for you taking today to answer all these questions and keeping us up to date. For folks who would be interested in listening again in case they missed anything, we will be uploading this onto our YouTube and we'll send it out to folks who registered. If you have any questions, feel free to reach out to me. Happy to pass things along and we can try and get your questions answered. But with that being said, thank you all so much for joining us. Have a great rest of your week and happy early Thanksgiving. And we will talk with you all soon.
Thanks, everyone.